I'm currently a senior at University of Central Florida's athletic training program. Evidence-based practice is a way for athletic trainers to get their patients and society's approval and get their knowledge up about what we actually do and what's actually effective in our area. Definitely, especially if the athletic trainer is in a clinic setting, just because with insurance companies, they want to know whether something is productive and effective. And if not, then the insurance companies will not reimburse the athletic trainer for their services. It's very important, especially for high school, just because there's some modalities that they cannot have because of income of the college. So they would have to find different ways and different routes to treat their athletes. And that's the best way to find out what's good is to research on it. And if there's more research, then there's so many more possibilities. Well, I feel like everyone in any type of field, health wise, should be doing EBPs. So that their patients understand what's going on, why they're doing it, especially insurance companies reimbursing them for all their services. Well, I had this funny story of going to one of my internships and realizing that they didn't truly use all of their modalities based on the fact that they realized that some things just actually don't work, some things aren't effective. And the only way that my preceptor knew that was by evidence-based practices and information that was being put out. Yeah, definitely, especially as a student. The curriculum basically makes you see that evidence-based practice is important. We get assignments that says, is ice practical? Is it effective? And you have to put that and into your practice and realize that yeah, it does work, but only for certain things. Definitely. During one of our semesters, we're basically talking about evidence-based practices for at least 2 weeks. They teach us how to find it. They teach us how to use it in the field and everything, so that when we do graduate, they make sure that we find out the effectiveness of different new type of interventions or old interventions. I think it's going to be a really long time just because there are some athletic trainers that don't think that it's important just because it's kind of relatively new in our realm, and it's going to take a lot of people, especially like students from colleges, to enforce that. So I see maybe in a generation or so, especially after when we're teaching our students and our interns about it, then it'll progress more and more in our field. Definitely. No one wants to do ineffective treatments. It's a waste of time, and the patient begins to not trust you anymore because it's not working.